This program is brought to you by Community Trust Bank, Medical City, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, a life-lifting news program for women. My next guest is Dr. John Lanou. He is a partner with Pediatric Surgical Associates here in Dallas, Texas. Doctor, welcome to the show.
Thank you.
We've had a great show already talking about the FACT program here at Medical City Children's Hospital. And what I'd like to discuss with you in this segment is kind of take our audience through the type of procedures you and your partners do at Pediatric Surgical Associates. And my understanding is this is a very specialized area of medicine. How many of you John Lanous are in the country right now?
The last data that I know of is 2005, and there were about 775 of us practicing.
Pediatric surgery.
Pediatric surgery. That's operations on babies and children only.
Countrywide, there's only about 775.
Correct.
Okay, wow. What was your, I'd just be interested, how many years of med school are we looking at for you to have?
Well, 4 years of medical school, and then 7 years of general surgery residency. Most adult general surgery residencies are 5 years, but in order to get into pediatric surgery, most people need to do another couple of years of research, and then get an additional 2 years of pediatric surgery training.
Wow.
So the bottom line is you complete adult surgery training first, completely, on through board certification in adult surgery, and then do extra training.
So what is the specific difference or the big overriding difference between operating on adults, obviously size factors, vice little children, that you'd have to go that extra amount of schooling?
Well, their little bodies are not just small adults, and it wasn't until the 1930s that was discovered, and that's when pediatric surgery split off.
Really?
As
okay.
a separate. In fact, there was a great tragedy in Nova Scotia where a lot of children were injured by a harbor explosion, and that was kind of the founding of the specialty when some adult surgeons from Boston went up to help and realized that we needed to know more about children and the way they respond to surgery.
You couldn't lump it in just a general surgery.
And so it's a lot of, we're not pediatricians. People at church will ask me, can you look at my child's ears? And I said, I haven't done that in a long time and known what I was looking at.
Right.
But we can take care of any surgical issues. The way I look at it is we do everything except brains, bones, and hearts.
There you go.
Because we do the chest and the abdomen. People like Dr. Mendelhoff do the hearts, and they're pediatric orthopedics and pediatric neurosurgeons. But all the rest of the general problems we can help you with.
Now you and your 4 partners talk about how your practice integrates here into this wonderful FACT program at Medical City Children's.
If they identify a woman carrying a fetus with a problem, we'll be happy to see them prenatally to talk to them about what to expect.
Right.
And we can give them kind of the broad range of this is the great case scenario, this is the bad case scenario, this is what we do to fix each. And
wow.
we sit and just have a nice quiet talk with them, and we usually have those appointments toward the end of the day where we have lots of time to answer all their questions.
Yeah, because it's a very traumatic time, obviously, for a new
Yes.
mom or for somebody who's,
and
yeah.
I think it helps to just not be looking into the unknown so much, but to have an idea of what's going to happen. Is my baby going to need surgery, right away? Am I going to be able to hold my baby? Am I going to be able to see my baby?
Right. The more information up front, you kind of assuage the fears and so forth of the parents, yeah.
And then they sometimes they'll come with a list of questions, which we love. If they don't, they get our number and they can call us back and ask us the ones they forgot.
Let's talk about some of the more common procedures that you and your partners perform on these little patients.
A real common procedure is what's called a Broviac catheter placement. It's a special IV line that the babies that are especially very premature babies, it's very hard to stick needles in these veins all the time, and they don't last very long. And if you're trying to give full nutrition and very large doses of medicines that you need to help the babies, we can put in a special IV that's done through a small operation, and it can stay in for weeks if need be.
Okay.
And then can be taken out through a very simple 5-minute procedure. But it allows the baby to get all their substances by just connecting.
Yeah.
And also draw blood off of them and allow them to not be stuck with needles all the time.
Yeah, so reduce that trauma and that interaction. Let's talk about, can you share with us, because I know you've dealt with so many families and so many children, is there any one in particular case that really resonated with you or that's most memorable in terms of dealing with the family and the ultimate outcome with the surgery?
Well, I just, yes, I've had a lot of memorable patients, but we we sometimes, when we look at a baby, when we first walk into the room after the delivery and we see a baby that's in a bad state,
Yeah.
and we look at the baby and the initial impression is this baby is not going to do well. Well, I just recently did what I hope is the last surgery on a relatively normal 3-year-old that I thought was not going to survive the night when I first met them as a premature infant, and with multiple problems. But if you break these problems down and just work on each one at a time,
Right.
they were all solvable. And this little child is doing much better than anyone expected.
Fantastic.
And is charging around terrorizing his sister, so it's wonderful.
As he should be. Yeah, that's great. Also, Doctor, I was going to ask you with this, as medicine is progressing with new technology, we're also seeing a lot more on the spiritual side of taking care of the whole patient, not
Right.
just the physical side, but emotional and the extended family. And this seems to be helping quite a bit in terms of.
Yes, and I am greatly in favor of that. I'm a seminary dropout myself.
Are you?
That's actually what I did right after college. I did not intend to be a doctor at all.
Really?
My wife got cancer while we were both in seminary, and got me interested in medicine. And so I went back to after I resigned from the seminary and went back to do medicine. And so I am sensitive to the spiritual side of issues, and and I'm happy to talk to patients about that if they so desire.
Absolutely, yeah.
And then if they don't, that's fine too.
Also, another area I'm interested in, if you're dealing with somebody from a different culture, ethnic background or religious background, is that something you and your partners have to take into consideration in terms of dealing with the care and the options and so forth?
Absolutely, and we, in the Dallas area especially, this is one of the most multicultural areas that you can imagine. My hobby actually is languages. One of my things that I like to play with. I don't have a lot of fluencies, but I know how to greet and be polite in
multiple
and I
languages?
learn these from my patients.
Really?
And
What,
so
give
it's-
us some
Well,
examples.
it's fun to surprise. I had a patient from Zimbabwe, and I had actually done a rotation in Zimbabwe as a medical student, and I still remembered a few words of Shona, which is one of the 2 languages there.
I bet it
And
thrilled.
I looked at the name and I thought, that name looks Zimbabwean. And I said, Magwanani amai, Magwanani, which is just good morning. And there was
Eyes
total
lit up,
shock.
yeah,
that-
yeah.
Where did that come from?
Oh, that's
and
fantastic.
then if I don't know, I often will ask the question, what other languages do you speak at home besides English? Or what other languages are the children learning?
That is so
And if
important.
they tell me one that I have no clue as to what it is, I say, well, how would I say hi? And I learn from them.
That's
It's a lot
phenomenal.
of fun. It's my
And I
hobby.
understand you have an interesting story that when you were in medical school and really hadn't declared specialization, you got something from your dad that you might want to share with the
Yes,
audience.
my father was a disaster relief person. So it was kind of an unusual way to grow up. And he was always combing, when he knew I was in medical school, he was looking for me a specialty. And he cut out a Reader's Digest article about pediatric surgeons and sent that to me, and that was very much formative in my looking into pediatric
Very
surgery,
interesting.
and basically never turned back. From about 2nd, 3rd year of medical school on, that's what I wanted to do.
Well, Dr. Lanu, also just before closing, I've asked some of your colleagues, how is working in life and death situations with these beautiful little babies, and you have success stories, but sometimes you lose some of your patients, how has that impacted you personally in terms of your viewpoint on life?
I have given a lot of thought. I'm married to a religious historian who has a philosophical bent, and we talk about these things a lot. I think the babies are here to be loved as long as you can love them, and that's the bottom line. We do our best to keep them comfortable and to do the best for them, and I'm amazed by some of these parents whose lives are turned upside down by these kids that need a lot of work.
Right.
But how loving and how wonderful their families are
Right.
As a result of these children.
Well, it's been fascinating to talk to you. You're definitely a Renaissance man, I must say. Dr. John Lanu, it's a pleasure. And if our audience partner at Pediatric Surgical Associates, how would they get information or contact you and your
It's
team?
DallasPSA.com.
That's easy.
Easy.
Another easy website. Way to go. DallasPSA.com.
We're working on it. It needs a little work, but you can get information as to how to contact us.
Terrific. Dr. Lanu, thank you for being on the program. Ladies and gentlemen, that wraps our show from Medical City Children's Hospital on the FACT program. I'm Siobhan Palmer with Platforms, the life-lifting news program for women.